Hi, my name is Mohammed Shilla. I'm a first-year radiology resident at John H. Torture Hospital in Chicago. I'll be talking about a case of Langerhans cell histiocytosis with Rosai Dorfman's disease. So there was a 58-year-old male who presented from an outside hospital with imaging showing multiple intracranial masses. Originally, we were concerned for metastatic disease from an unknown primary. The patient presented with laboratory findings consistent with pan-hypopituitarism, as well as skin lesions that dermatology was consulted for. The patient had a CT of the chest, abdomen, and pelvis performed to find the primary malignancy. Here are two post-contrast axial images of the abdomen. There is a regular soft tissue encasing the aorta and ureters. You can see it here and here. And the right hepatic lobe was atrophic, and there was mild right-sided hydronephrosis. The patient later had a MRI of the brain post-contrast. These are two T1 axial images in the coronal plane and axial plane. There's a large intraaxial mass in the right frontal lobe with mass effect on the right lateral ventricle, and there's a left extraaxial mass in the frontal lobe. The patient had a punch biopsy of the inguinal rash. Findings returned favoring Langerhans histiocytosis, and the pathology from the intracranial lesions favored Rosai Dorfman's disease. Additionally, the patient also had brain and bone findings possibly related to Erdheim's-Chester disease, another type of histiocytosis. They're currently being treated with dabrafenib and showed improvements in symptoms as well as imaging findings. A couple important points to take away from this case is that histiocytosis, although uncommon, should be a possible consideration when there is concern for an occult malignancy, as many symptoms do overlap. And a multidisciplinary team approach is most effective as patients typically have involvement of many different organ systems. If you have any questions, feel free to contact me or my colleague. Thank you.